Hello, everyone. My name is Dr. Federico Colecchia. I'm a full-time academic at Brunel University of London. My research work is at the intersection between human-centered design and technology development. And I'm here today to talk to you about a piece of research that was recently published together with my great colleagues in the Journal of Medical Internet Research. We have proposed the design of a new socio-technical ecosystem to streamline ethical monitoring and promotion of mental well-being for the benefit of individuals, employers, care providers, government authorities. The operation of the ecosystem is to be enabled by emerging digital technologies. Think wearable devices, mobile phone applications and sensors, and other technologies as well, including data analytics. And I will come back to this point later. There are clear benefits to this ecosystem, to the development of such an ecosystem, in terms of detection of early stage issues, for example, and provision of suggestions and prompts to users so they can improve their well-being and be empowered in terms of taking charge of their own well-being. This project would not have been possible without the convergence of specialists from different disciplines. I'm talking about emerging technology, but also design for health, arts, therapies, business and management. This is just the core research academic team, but there are other collaborators now who are joining the team as well. So the skill sets become even richer, which is very, very important. The involvement of all stakeholders I mentioned before, individuals, employers, care providers, government, in a code design process throughout the research is essential, because this is a sensitive research topic. We're talking about mental well-being of individuals and modern technologies. Of course, things have been done properly. They have to be done responsibly. So it's a very important element of the research to have this code design going on throughout, so that every stakeholder can feel and actually be empowered to contribute to shaping this ecosystem from the ground up. Of course, we're talking about ethics here. We're talking about transparency, data governance. Think about the potential benefits of such an ecosystem for integrated care teams, where individual teams can share data ethically with, of course, full consent from the individuals. There are important aspects of the research, and one of them will be the co-design of a new way of presenting well-being data to individuals. The reason being that individuals' willingness to share their personal well-being data is critical for this ecosystem to be able to work in the first place. If you ask me, are you happy to share your well-being data? I would definitely ask you several questions before I give my consent. I want to know who is processing those data, what information is going to be shared with whom, and for what reason, and most importantly, what am I going to get out of it? What benefits are in it for me? So it's very important to cover that element very, very well. And this is why we have proposed also, as part of this research, a new way of presenting well-being data to individuals, away from the traditional charts and numbers that, of course, have a purpose and have been in place for a reason, and they do serve the purpose. But they can be confusing sometimes, they can be difficult to interpret, or maybe difficult to contextualize. So we have proposed a new way of visualizing and presenting more generally well-being data to individuals in a way that is based on relatable metaphors. Now, sadly, this is a short video, and I can't tell you much about this, but you will be able to read all about this in the actual paper, in the full article, and I'm sure there will be a link somewhere so you can access it. Okay, why the Journal of Medical Internet Research? Well, apart from the obvious match between the research topic and the coverage of the journal, I'd say that as an author, I've had a very good experience as well. I've published for the last 25 years, so I've seen different things, and I have to say that the Journal of Medical Research has handled the process quite well, and the output is good as well. So I'm very happy with it. As I mentioned before, the core team is interdisciplinary, and the team is growing, so we're gaining more collaborators now. But we're always happy to speak with anyone who is interested in contributing or being involved in any form, or even providing feedback, constructive criticism. So please, if you are one of those people, feel free to reach out, because we'll be very happy to hear from you. We'll add a QR code in my Brunel email address, so please don't be shy, just reach out if you want to talk to us.